Why is understanding embryo selection important for reproductive options? Imagine being able to choose the best possible start for a future child. That's what understanding embryo selection can help families do. When couples face reproductive challenges, knowing about embryo selection becomes a powerful tool. It's not just about having a baby, it's about making informed choices to improve health and success rates. Embryo selection involves testing embryos before they are implanted during procedures like in vitro fertilization. This testing looks at the genetic makeup of each embryo to find the healthiest ones. The main method used is called pre-implantation genetic testing. It helps identify embryos with the right number of chromosomes, which is key for a successful pregnancy. Embryos with abnormal chromosomes are more likely to result in miscarriage or health issues. There are different types of genetic testing. One is called pre-implantation genetic testing for aneuploidy. It screens for chromosome number errors, which are common causes of pregnancy loss. Another is pre-implantation genetic testing for monogenic disorders. This detects specific inherited diseases like cystic fibrosis or sickle cell anemia. The third type is pre-implantation genetic testing for structural rearrangements, which finds structural issues in chromosomes that could cause problems later. Knowing about these tests helps couples and doctors decide which embryos to transfer. This can increase the chances of a healthy pregnancy and reduce the risk of passing on genetic conditions. It also lowers the chances of miscarriage by selecting embryos with normal chromosomes. Using embryo selection can make the process faster by reducing the number of IVF cycles needed. It also encourages single embryo transfers, which lower the risk of multiple pregnancies. Some genetic tests can even tell the sex of the embryo. This can help with family balancing or avoiding sex-linked diseases. Emerging techniques are also starting to estimate the risk for complex diseases influenced by many genes, though these are still being studied. It's important to remember that embryo selection isn't perfect. It doesn't guarantee a pregnancy or a healthy baby. False positives or negatives can happen, and ethical questions may arise about choosing embryos based on certain traits. Additional costs and emotional impacts are also part of the process. From a family genetic planning perspective, understanding embryo selection allows families to reduce the risk of inherited diseases. It helps them make choices aligned with their values and health goals. This knowledge supports better counseling and personalized reproductive options. Overall, it's a way to take control of reproductive decisions with the help of advanced genetic information, making the journey to parenthood more informed and hopeful.